quick check-in on this syllabus schedule. So today we're talking about cancer. Before we do that, we've got to finish up a little bit of the nervous system. And I actually added a couple slides. You're like, what? Well, I couldn't resist because I didn't get through the whole thing, so we paused, and there's another topic that I wanted to introduce. So you'll see that. Those new slides are already updated on VB Learn. So if you go to VB Learn, you can download. There's 2 extra slides. Okay, that's it. So cancer today. Next week is endocrine disorders. And then we have Veterans Week. And the 12th is Veterans Day. And so we don't have class on Veterans Day. And that week, you don't have any content that's new. So that's the week to study for this next exam. Because the week following, the 19th, which is the Monday before Thanksgiving, we have our second exam. Okay, I think it's much better to have the exam before Thanksgiving versus after Thanksgiving. Okay, at least for this class, you get it done, catch a flight on Tuesday or even Monday evening, whatever you want to do, and you can take some time off. Some of you are like, well, I have other classes that have exams the following week. Well, the drop deadline is November 2nd. So you can drop those classes if you want to. And that actually is being recorded, so I probably shouldn't have said that. Any questions about the schedule? Okay. And when we come back from Thanksgiving, it's like the semester goes super fast after that. It almost feels like it's over. We actually only see each other 3 more times. 2 of them are for lecture, and then the last one's for the final. And then you'll see the week of December 3rd, we've got 2 lecture contents. We've got respiratory and cardiovascular. It's a little unusual that we've got Labor Day and Veterans Day that chew up a week of class. And that's what happened this semester. And so that's why there's respiratory and cardiovascular crammed into 1 week. So I'm going to lecture on cardiovascular, and you're going to watch the online lectures on respiratory. So if you want to look ahead, like over Thanksgiving, right? Because you'll have an exam and it'll be done. And I wouldn't do it before the next exam. I do it after the next exam, like Thanksgiving week. If you got a little downtime, you're tired of shopping, you're tired of pumpkin pie, maybe you can watch a lecture and fall asleep, okay? Okay. So respiratory will be online, and then cardiovascular will be the content that we're covering in that last lecture. Make sense? Okay, just giving you guys a snapshot of what's coming. What has 2 holes, no legs, and runs? 2 holes, no legs, and runs. A nose. Why was 6 afraid of 7? Because 7, 8, 9. Very good. Okay, this one's good. Why does DNA have no fashion sense? It unzips its genes? That's awkward, yep. That would be awkward. There's a lot of options here. My daughter came up with it, always wears the same old jeans. Okay, like that. But we nerded out a little bit, and there's some secondary answers. Okay? It reads forwards and backwards. It's sensitive to reverse transcriptase. Right? It's easily unzipped. Or you get them from your parents. That was actually a student that came up with that one. So yours unzipped is actually on here, right? It's easily unzipped. All right. Any questions about where we are, what we're doing, where we're headed? Okay, cool. So what we need to do is we need to pick up on dementia. And this was the last slide that we ended on. And I told you that we would start here because we're kind of starting to wind it down the last couple of minutes of class. And I didn't want to try to rifle through the last 2 slides. Because I paused, we have the last 2 slides to do. Plus I doubled it. Now we have 4 slides. Okay? But I think you'll see why. So dementia. This is a very prevalent neurological disorder later in life. And one of the most common forms of dementia is Alzheimer's disease. And I've had a number of students that have come in to office hours that we've chatted about last week's lecture, because, and probably the same thing's going to happen about this week's lecture when we get to cancer. Because when we talk about neurological disease and we talk about cancer, I feel like 100% of us have experience with one, if not both of those topics. With a close loved one, whether it's a close friend or a family member, okay? And Alzheimer's is in this category, which is the most common dementia. It's not the only one, but it's the one that we talk about the most. And we said last week that the risk factors, and I'm going to review them, are age. The older you are, the more at risk you are for developing Alzheimer's. Any evidence or prior history of head trauma. Females are more likely to have a higher percent impact of Alzheimer's. And maybe that's because they live slightly longer, so maybe on average the age of the female population patient is older than the male population patient, and that's why they develop it to a greater extent than the males. It might be that males pass away from cardiovascular disease earlier, and they don't develop Alzheimer's. And then we talked about this sort of controversial statement, which is educational level. And I don't know if any of you looked at the videos that are on YouTube, but there were like 3 additional videos. Actually 4. There's a Dr. Miller video, and then there's like 3 additional patient videos. The Dr. Miller video is about like these recorded videos. He was a guest lecturer that used to come in. He was an old medical school professor, and he's my neighbor. And in years past, he would come in and do this a secondary nervous system disorder lecture and talk in a lot more detail about Alzheimer's. And so I'm not going to test you on his lecture, but if you're interested, there's more content there. And then in his lecture, he went and showcased 3 patient videos, and those are also posted on YouTube. Those are the ones that were converted from old VHS tape to digital format, so they're really rough as far as AV quality. They're definitely not 4K or Blu-ray or anything like that. Okay, so some of you are like, "Holy cow, what am I watching?" Okay, that was like the old school VHS recording, and the tapes actually deteriorate. So we kind of captured it as it was deteriorating, but we preserved it so it's not any worse. So there's a lot more information there if you are interested. And on one of those videos, there's these 2 twin brothers that get interviewed. One of them has Alzheimer's, and the other one doesn't. And they're interviewing the brother that has Alzheimer's, but because he's a fairly educated individual, you can kind of appreciate in the interview by the psychologist who's trying to diagnose him that he's actually trying to creatively avoid some of the questions. She holds up a comb, and he kind of goofs around with her and says, "Oh, she's like, what is this?" And he says, "Well, you know what that is. I mean, men use it more than women, but he can't remember the name of it." And so you're like, is he toying with me? Is he being coy, or is he actually not remembering? He doesn't remember, but he plays it off, and he does a really good job with it. Okay? Or she holds up like a pencil, and he says, "Oh, well, kids like to use it. The other side, they can change their answers with, right? If they make a mistake, of course, we all know what that is." And he says, what is it? But he never says the word pencil. Okay, so little things like that. And I don't remember. I think the comb is the one. I don't know if it's a pencil is the other one, but a comb is definitely one of them. And you can see this interview where, because he's intelligent and he's fairly educated, he's trying to play off in this interview and give her a rough time of diagnosing him. And so in some of our families, it's really hard to pinpoint if dad or grandpa is developing or grandma's developing Alzheimer's, because they may not want to burden the family, so they're trying to pretend like, I just misplaced my keys, it's no big deal, and then they are driving around town saying, "Oh, I was just going for an extended drive," but they actually got lost, they don't remember where they live, okay? So that's what that 4th category of low education level is. So the lower the education of the individual, it's less likely they're going to be able to play it off and hide it from their families or their loved ones. It's harder for them to get away with that, okay? So what's going on this screen? Well, and we covered all that. What we didn't get a chance to cover is some of the histology that's on the screen. And I talked with some of you in my office hours on autopsy. And we don't really know if it was chicken or the egg. On autopsy, when we get patients that have donated their tissue for science or medicine, we can look at the neural tissue and get histological samples, and that's what you're seeing here. And on those histological samples, we see Alzheimer's patients that have these beta amyloid plaques, okay? And they have these tau protein tangles. And so these are portions of the neural tissue that are altered, and they're causing scarring in the neural tissue. And when the scarring is present, it's more challenging for that nerve conduction signal to actually transfer or be propagated. And so we see that Alzheimer's patients that were diagnosed with Alzheimer's have these types of lesions. But we do see patients that have lesions that were never diagnosed with Alzheimer's. And so there's been this debate on, is it the Alzheimer's that causes the lesions, or do the lesions cause the Alzheimer's? The conventional wisdom, or the prevailing thought currently, the central dogma is that the lesions form first, and that leads to the symptoms of Alzheimer's. Okay? But I want to propose the other argument, which there are a minority of the researchers that think that's not definitive. We don't know if it's truly that first and then second. It could be the opposite. Okay? So what we're looking at here is you can see these beta amyloid plaques as they form. And so these brown spots of tangle or plaque, here we've got the structure in the phospholipid bilayer. You can see the amyloid precursor protein. And you can see that under certain circumstances, this will rearrange and cleave, and you get these alpha-beta aggregates, and then you get these amyloid fibrils. And as they separate over time in these patients, these aggregates and these fibrils actually form these beta amyloid plaques, which are outside of the cell. They're not in the neuron, they're outside of the neuron, they're extracellular, and they're basically like a neural scar. The neurofibrillary tangles, or the amyloid fibrils, these actually form intracellular lesions inside of the cell. So you've got an extracellular beta amyloid plaque, and you have an intracellular fibril tangle. Okay? And that's what you're seeing on here as the beta amyloid plaque, and here you're seeing the fibroid tangle that's inside the cell. Now, the last thing that we see is the formation of these tau protein conglomerates. And the tau protein conglomerates that you're seeing in the far right in C are very, very similar to what we see with CTE, and I'm going to talk about CTE in a second. So we've got kind of three different pathologies that are happening. We have these amyloid plaques outside the cell. We have these intracellular amyloid fibrils, and then we have tau protein, which is a protein that typically reinforces the neural architecture. And when it starts to degrade and fall apart, we actually see compromised architecture within the neurons and the surrounding neuronal structure, and that compromises action potential from flowing. Okay? So this first appears as higher order brain function losses, cognitive functions, memory, being able to make good decisions. Higher order would be personality changes. Okay? Intellect, bless you, not as much on raw intelligence, it's more that they're forgetful, and so they may not appear as bright as they were before because they can't recall information like they used to be able to recall it. We rely very heavily on our memory, our short-term and our long-term memory. Okay? That's what gets us through the day. It's kind of like your cache file on your internet, right? There's a lot of data that's stored in that cache file in order to bring up websites faster and make things run more smoothly. And so when it is completely deleted or depleted, you have to go reload the entire thing, and you can't recall it very fast, and that's when your website actually goes a little slower. It's the same thing that happens with our brain and our memory, our short-term memory as well as our long-term memory. Okay, now, Parkinson's disease. So this was at the Barrows Neurological Institute, and of course, Muhammad Ali was diagnosed with Parkinson's disease. But now we're starting to wonder, there's a group of clinicians that wonder if it truly was Parkinson's, or if it was the CTE that we're going to talk about next. Now, Parkinson's disease is a little unique from Alzheimer's. It really tends to target the midbrain, which is part of the basal ganglia. And most of these cases are idiopathic, meaning we don't really understand why they show up. But what we do know is that dopamine stimulates the substantia nigra, which in turn inhibits unwanted movement. And so in Parkinson's disease, we see that this dopamine is reduced and the unwanted movements actually are facilitated. And so that's where you get this tremor that comes with these end-stage Parkinson's patients. You can see in the gross images that are shown here, we've got a normal substantia nigra, and you can see the pigmentation illustrating the amount of dopamine that's actually being released. And you can see a depigmented Parkinson's patient in the substantial nigra where dopamine levels have been reduced. Now, the last two slides are new, and the reason I put it in here is because of the popularity in the news. I talked about my daughter having a mild concussion. We actually took her in last week to see the doctor because she's still kind of having some mild headaches. They checked her out, they did some tests, and she's fine. It might have been a mild concussion, probably was nothing more than a very low-grade concussion. But parents are freaked out about this because there's so much new information, and rightfully so. There's so much new information about this CTE disorder or disease. Okay, it's probably more appropriate to call it disease. Chronic traumatic encephalopathy. So this is a progressive degenerative disease in patients due to repeated concussions or traumatic brain injuries. We used to think that this was only found in boxers, okay, in this boxing population. And so there's a lot of debate on, did Muhammad Ali actually have Parkinson's, or did he actually wrestle with CTE? Okay. There was a movie, a Hollywood movie with Will Smith. I don't know if any of you saw it. How many of you guys seen the movie Concussion? It's a I would highly recommend you go watch it. Phenomenal job. Will Smith just knocked it out of the park. Okay, I don't even want to talk too much about it, other than it's about CTE, but just the acting there is just going to blow your mind, literally. I mean, you're going to be like, holy cow. The top's going to go. Okay. He really did a great job in that movie. And he was portraying this physician that helped to discover. It was a partnership. So Bennett Amalou and Julian Bales were the two MDs that actually first described CTE. And the movie's about Dr. Amalou. Okay? And he's a non-native U.S. physician. So you'll see Will Smith play that role really well. And he was investigating pro football athletes. This is the year 2002. So this is not that long ago, right? In your lifetime, this happened. And in CTE, we see that the brain shrinks or atrophies in certain areas, and in other areas it becomes enlarged. We don't really understand why that is. Again, this has probably been around for a while, but it was literally just described about 16 years ago, so we don't know much about it. But what we do know is a lot of the symptoms of CTE patients kind of straddle Parkinson's and now I forgot Alzheimer's. Gee whiz, isn't that ironic? Alzheimer's and Parkinson's. Okay, so a lot of these diseases, a lot of the CTE patients suffer from things like memory loss, impulsive or erratic behavior, impaired judgment, very aggressive behavior, depression, balance issues, and the onset of dementia. And what we see in the brain tissue is we see that there's this accumulation of tau protein. As we get these patients' samples, post-mortem, we're seeing that the tau protein is accumulating at high levels in a format that is unstabilized. So typically, the tau protein stabilizes the cellular structure of the neurons, and when it becomes defective, then you have a major compromised activity of these neurons, because tau is actually impeding neuronal flow versus supporting it. If we look at what this looks like grossly, you see a normal brain cut in coronal view, right? So you're looking at it right down the front. You can appreciate on the left of this normal brain, we've got our left hemisphere, our right hemisphere. You can appreciate the lateral ventricles here. Over here is advanced CTE, so we've got significant atrophy of the right side, correct? And you can appreciate them, overall you've got atrophy in comparison to the size of the lateral ventricles. So these activities now are not limited to boxers or pugilists. Now we're seeing it in professional football players. We're worrying about any type of collision sporting event, right? So we're worried about soccer. There's a lot of head trauma. Actually, next to football players, the number 2 population, I did a bunch of research over the weekend, because I was going to explain this to you. And then my daughter just had this head injury, right? So the number 2 population of head injuries is female soccer players next to male football players. So it's male football players, female soccer players, and football players actually wear helmets, and soccer players typically don't, okay? So awareness is going up. There's a lot more education about kids wearing helmets when they're riding bikes or skateboards. I mean, when I was a kid, hardly anybody wore a helmet. The kids that wore helmets were the ones that were like competing in BMX or something like that. They didn't wear it down the street. It's a lot more awareness today on this CTE, and this is because of the reason is we're seeing a lot of patients now that are presenting with Alzheimer-like symptoms or Parkinsons-like symptoms, and they're young. And you'll see this in this concussion movie. It's actually a great movie. I would encourage you to watch it. I think you'll find it. You'll nerd out a little bit, but it's very entertaining. Question?
Why is it found more in female soccer players than male? Is that related to Alzheimer's being found more in females than males?
Oh no, it's not necessarily CTE is more in female. I'm just talking about head injuries.
Okay.
So the 2 sporting activities that have the highest number of head injuries are male football players, and then number 2 are female soccer players.
Okay.
And last night at the dinner table, I have all daughters. We were talking about this lecture, and I had this on the wall while we were eating our meal. Just kidding. But it wouldn't be unlike me. But we were talking about the statistic that we just had learned about, and so we were trying to understand why there aren't, why male soccer players are at a less prevalent rate than female soccer players, and so my 9-year-old said, well, men's soccer players are just a bunch of babies. and there's some truth to that. If you watch, I actually would prefer to watch female World Cup soccer than male World Cup soccer, because when the females, get hit or injured, they fall down and then they hop back up. And in the males, there's this whole performance that you have to watch as they roll on the ground, and then they fix their hair when they get up. And, it's like, just play soccer. So that came from my 9-year-old. So I don't know if she's right, but I don't know, maybe. Any other questions? Okay. So CTE is a little new. Only about 16 years that we've known about it.